This segment of Delmarva Life is brought to you by Peninsula Regional Medical Center.
The next topic we would like to address, actually it's up to you.
Yeah, this is your opportunity to bring up anything head to toe, and we vow to get you an answer.
And as you might have guessed, it is time once again to Ask the Doc. Probably recognized this guy, Dr. Chris Snyder, who's the Chief Informatics Officer and Hospitalist with Peninsula Regional Medical Center. Thank you so much again for joining us today with your endless wisdom and all the things you know.
It's great to be here.
Okay. So first question comes up a lot. What is considered appropriate use of the emergency department?
Well, the ER, it's emergencies, which has a relative term, I guess. We see about 95,000 visits a year in our emergency department for a small town. That's probably one of the largest in Maryland, next to Hopkins and University of Maryland. So very busy place. There's a lot of, might you say, urgent and non-emergent situations that tend to come there just because people don't have access. Peninsula and the medical staff are working very diligently to improve access in the community, but it's difficult after 5. So obviously emergency is a relative term. It's very subjective, so you have to make your own determination. Emergencies, cuts, bumps, bruises, injuries are obviously fairly emergent, especially if the scenario is bad. But there's a lot of medical reasons, common colds, etc. Question is, do you wait or not? And there are some programs going on where we're trying to develop helplines so folks can call and at least ask the question, do I need to do this or that? We need to all do a better job of that in healthcare, just making sure folks, because it's tough. It's a tough call. Even with kids and a wife, it's really tough. They don't always necessarily make the right decisions.
Yeah, that's a good idea, having someone to call ahead of time. Okay, I'm going to read this one. This is from a viewer, and it's kind of a long question. I am in what's called the sandwich generation, in between raising my children and caring for my parents. My mother is aging and dealing with diabetes, but also struggling with congestive heart failure. She's also showing signs of memory loss. What services are available to help me help her manage her condition?
Yeah, this is why I have a job, and most healthcare providers are, and I think healthcare is in the situation we're in. As again, back to my previous comment, accessibility and understanding all these diseases. There's programs at home that can help with this. Medicine's one of these things that there's a lot of experience necessary for you to make the right decisions. Not everybody's born with those decisions, let alone being able to go to the store and perform activities of daily living, which many of our elderly cannot. So there's services we provide, much like the home nurse services. Peninsula Home Care has the ability to go into the home, educate not only the patient but also the families. There's some wonderful programs out there we're all trying to develop, but again, it's resource intensive. These folks with chronic conditions have diseases that are irreversible, and potentially years and years and years of decline occur. Very difficult to manage as a loved one. In fact, near impossible. Again, with my own family, it's challenging, and you know, it's very difficult to understand when to make decisions. So resources are important in the home, and getting home services to come to the home, a nurse, a pharmacist, a respiratory therapist, whatever the patient needs, into the house can do a world of help, and those services can be achieved. You get those services, our case managers work through that. When we send people home, we try to help them with that. Some people don't meet criteria to go to nursing homes, so it's a very complicated process, and there's no one right answer for any of it. It's very individualized. So,
but there's help.
Absolutely. You just have to access those services, and Peninsula Home Care is our branded product that goes into the home and really does do a great job with home therapy, home education, nursing, etc. Right. It's a very difficult situation for families.
So tough job you're doing. God bless you. All right. Next question. Our viewer writes, for some reason I bruise easily. They take forever to go away. Also, my skin takes forever to heal. If I get any type of a scratch or even a small bump on my face will turn into a scab, just stays and stays. It seems like anything to do with my skin takes forever to heal, and I'm always pale and blotchy and don't tan as easily as most people in the summer. Any idea what this could be?
So what's the largest system in the body?
the skin.
Yeah, it's called the integument system. So the skin is your protection from the environment. A lot of us have different skin types. There's black skin, yellow skin, hopefully no green skin, Martians. But we do deal a fair amount with the changes in skin. Not everybody has, and again, a lot of it has to do with certain things. We talked about baby eye color a couple months ago, I think.
Right.
You know, it has the same impact. So melanocyte, which comes from the skin, actually protects you from sunlight. It protects you from the environment. Some folks don't produce as much melanocyte. Diabetes has an effect on the skin. Nerve systems have an effect on the skin. Everything affects the skin. Diet and nutrition are extremely important. Activity, increase in blood flow. Folks who have very pale skin are at risk for not healing as well, and they tend to have an effect on that. So it really does play a role, and any kind of exposure to the environment can break that wonderful gift we've been given that protects us from the environment, which is your skin. So from your toenails to your tip of your head.
All right, Dr. Snyder, we were talking about this today. I think we had temperatures in the 70s yesterday. Temperatures in the 30s today. Is it true that these drastic temperature changes make people feel sick, or can make people sick?
You know, again, I came from Florida yesterday. Oh.
It felt like Florida here yesterday.
Come back.
30 this morning. Sorry, I gotta get off of that. But anyways, yes, there is an effect. The environment plays a role in everybody's life. Again, you know, the sick, the debilitated, folks who have chronic illness, absolutely has an effect. It's somewhat of a wives' tale. Cold temperature is actually not a bad thing. It actually stimulates the skin when you rewarm it. You just don't want to get too cold. So when you get to a temperature that's below the normal temperature,
right,
is where you can get in trouble. So you just have to be careful with it. But the environment, absolutely, you got to protect yourself from long-term exposures. Short exposures, probably not going to drive the cold home. You're going to get that cold anyways.
You'll be
All
right.
right.
You'll be right. Dr.
Yeah.
Snyder.
Yes.
Dr. Snyder.
Thank you, sir, very much.
Keeping those germs in check. All right.
Absolutely.
To read more about Peninsula Regional Medical Center or to submit a question you'd like Dr. Snyder to answer, go to delmarvalife.com.